Hi everyone. Today in this video I am going to talk about one of the medication, Silodosin. What is this drug Silodosin? The suffix osin indicates that this drug is one of the alpha-1 blocker. This is one of the selective alpha-1 blocker which shows high affinity towards alpha-1 adrenergic receptors. Alpha-1 receptors are highly located in various types of smooth muscles including vascular smooth muscle, bladder, prostate and urethral smooth muscle. These alpha-1 receptors are having different subtypes, and among them alpha-1A subtype receptors are more important in the smooth muscles of prostate. Now Silodosin is one of the selective alpha-1 blocker. This drug can block the alpha-1 receptors as well as it can also block alpha-1A receptors with high affinity. Therefore, this drug is highly selective towards alpha-1A subtype, which is mainly located in the prostate smooth muscle. Around 75% of alpha-1 receptors on the prostate smooth muscle are of alpha-1A type. Now on this receptor, Silodosin can selectively bind with high affinity. So this is one of the drug which is highly selective towards the prostate smooth muscle. In the normal people with normal size of prostate gland, urine flow is free and it is not obstructed. But in the people with any prostate enlargement, we can observe the increased size of the prostate which can produce the obstruction of the flow. This prostate enlargement can produce some pressure at the base of the bladder. This increases the urinary frequency, but at the same time the urethral flow is blocked because of enlargement of the prostate. So in the people with benign prostatic hyperplasia, BPH, we can observe two important symptoms. The first one, we can observe increased urinary urgency because the bladder neck is pressed by enlarged prostate. And the second symptom is the weak urinary flow because of obstruction of urethral pathway. So in such patients, even the urinary frequency is increased, still urinary flow is reduced, resulting in urinary retention and obstruction of urinary flow. Even BPH is not a harmful condition, but if it is untreated, it may lead to various urinary complications. So in order to treat BPH, we have different types of alpha-1 blockers like prazosin, doxazosin, terazosin and alfezosin. All these drugs are selective alpha-1 blockers, but they are having the high selectivity towards alpha-1 receptors. They are not differentiating the alpha-1 subtypes, but Silodosin is one of the drugs which can selectively bind to the alpha-1A receptors which are mainly located on the prostate smooth muscle. Just like another drug tamsulosin, Silodosin is highly selective towards alpha-1A receptors. That's why this drug is somewhat useful in the treatment of BPH. Here we can observe at the base of the bladder, alpha-1 receptors are mainly located, and at the prostate smooth muscle and prostatic urethra, alpha-1A subtype receptors are mainly located. Now Silodosin can block both alpha-1 receptors at the bladder neck as well as it can block the alpha-1A receptors at the prostate smooth muscle and urethra. Because of these actions, Silodosin can improve the symptoms of BPH. So today in this video we are going to discuss what are the important precautions of Silodosin, how this drug acts at the molecular level, what are the important side effects, doses, all these things we will discuss in this video. First of all, let us see how this drug acts. On the smooth muscles of prostate and urethra, alpha-1A receptors are located, which are G protein coupled receptors coupled with alpha beta gamma subunits. When these alpha-1A receptors are occupied, they can activate PLC, phospholipase C. This phospholipase C is one of the cleavage enzyme which can convert the phosphatidyl inositol biphosphate into two fragments. One is the IP3 inositol triphosphate and second one is the DAG, diacylglycerol. This IP3 can act on the IP3 receptors located on the sarcoplasmic reticulum. When these internal receptors are activated, it can release the calcium from the intracellular stores. And DAG can interact with the phospholipids to produce one of the enzyme, protein kinase C. This protein kinase C is one group of enzymes which can increase the expression of inward going calcium channels. Now calcium can more enter into the cell, resulting in the pronounced contraction of smooth muscle. In this way, alpha-1A receptors are responsible for contraction of smooth muscles of prostate and urethra. Now, silodosin is one of the selective alpha-1A blocker. It can block these receptors, thereby it can reduce the contraction of smooth muscle, leading to relaxation of smooth muscles of prostate and urethra, as well as the bladder. Because of all these actions, it can increase the urinary flow and it can reduce the urinary frequency. Now let us the precautions of silodosin. Just like many of the alpha-1 blockers, silodosin can also produce vasodilation. This drug can act on the vascular smooth muscle which is expressed with alpha-1 receptors. Even if this drug is highly selective towards the alpha-1A subtype, but still it can show some activity on alpha-1 receptors which are expressed on the blood vessels. Now when these receptors are blocked, it can produce vasodilation. This vasodilation results in the orthostatic hypotension. This is the drop in the blood pressure by change in the posture, which may result in some lightheadedness and dizziness in the people. So this dizziness produced by silodosin may impair few of the daytime activities. So while driving with the vehicles or working with machinery, this drug should be carefully given. And sometimes it can also develop the syncope, the falling sensation in the people. In few of the people, we can also observe the increased heart rate resulting in tachycardia because of significant orthostatic hypotension. So dizziness is one of the important precautions that should be considered with use of silodosin, which is particularly observed within the early days of the therapy. Similarly, when this drug is combined with other drugs like PDE5 inhibitors, phosphodiesterase 5 inhibitors, various drugs like tadalafil, sildenafil, evenafil, vardenafil, all these drugs are phosphodiesterase 5 inhibitors. They can be used for the treatment of erectile dysfunction, and few of the drugs can also be used in the treatment of pulmonary hypertension. And here tadalafil is one of the drugs which can also be used to treat benign prostatic hyperplasia in those people with excessively enlarged prostate gland. These drugs should be carefully combined with silodosin because silodosin can act on the blood vessels to produce vasodilation, and these drugs can also produce vasodilation by increasing the cyclic GMP levels. So combination of these drugs may produce significant vasodilation. That's why with PDE5 inhibitors, alpha-1 blockers like silodosin should be carefully combined. Another precaution is the people with renal impairment. Normally silodosin can be excreted through the renal system, but in the people with any renal impairment, the excretion of silodosin is somewhat reduced, which may increase the plasma concentration of this drug. So we can observe elevated levels of AUC, area under the curve, the increased plasma concentration of this drug, which increases the adverse effects associated with this drug. So in the people with any renal impairment, the dose of the drug should be reduced, otherwise it can produce significant dizziness, lightheadedness, and orthostatic hypotension. So in such people, instead of 8 mg of the dose of the drug should be reduced to 4 mg. But in the people with severe renal impairment, use of silodosin is contraindicated. Similarly, in the people with severe hepatic impairment, use of silodosin is contraindicated as it impairs metabolism of this drug, leading to toxic effects. Next important precaution is in the drug interactions. Silodosin is metabolized within the liver, and one of the important enzyme is the CYP3A4, cytochrome P450-3A4 enzyme. By this enzyme, silodosin is converted into its inactive metabolites. So the metabolism of silodosin is highly influenced by the activity of CYP3A4 enzyme. Few of the drugs like ketoconazole, which is an antifungal agent, clarithromycin, which is a macrolide antibiotic, ritonavir, which is an antiviral agent, itraconazole, again another antifungal agent. All these drugs are the strong inhibitors of CYP3A4 enzyme. So when this enzyme is inhibited, the metabolism of silodosin is reduced, which increase the toxic levels of this drug within the plasma. This leads to significant side effects like severe hypotension and lightheadedness. That's why with these strong CYP3A4 inhibitors, silodosin should not be used. Another important precaution of this drug is in the cataract surgery. Before the cataract surgery, the use of silodosin should be avoided because this drug can produce one of the syndrome, intraoperative floppy iris syndrome. This is a condition where we can observe the decreased pupillary dilation because of flaccid paralysis. We can observe reduced pupillary dilation, which may impair the cataract surgery and implantation of lens. That's why before the cataract surgery, silodosin should be avoided. Now let us see the side effects of this drug. The central side effects of silodosin mainly include the dizziness. It can produce some lightheadedness in the people, and it can also produce some headache, diarrhea, and postural hypotension can be observed. Other side effects mainly include nasopharyngitis, because alpha-1 receptors are importantly located within the nasal blood vessels. When their activity is modified, it can produce either nasopharyngitis or nasal congestion. It can also produce some skin rashes, and retrograde ejaculation is particularly observed, where there is decreased ejection of semen can be observed in the men because of alpha-1 blockade. Now let us see the chemical nature of this drug. So this is the structure of silodosin. Here we can observe it is having the heterocyclic ring system, which is nothing but the indole. So we can give the numbering. This is 1, 2, 3, 4, 5, 6, 7. Now this indole is having a carboxamide at the 7th position. So we can write this as indole 7 carboxamide. And it is having the saturation and 2nd and 3rd position. So 2,3 dihydro. First position it is having the 3-hydroxypropyl chain. So 1-3 hydroxypropyl. 5th position is having the propyl chain, so 5-propyl. Let us give the numbering to this propyl. This is 1, 2, 3. So at the 2nd position is having the amine group, which is attached to ethyl, so 2-ethyl amino. Again, let us give the numbering to this ethyl. This is 1 and this is 2. To this ethyl amino chain, at the 2nd position phenoxy group is attached, so we can write this as 2-phenoxy. Again, if we give the numbering to the phenyl ring, this is 1 and this is 2. Again, at the 2nd position, we can observe a side chain. This is nothing but 2-222-trifluoroethoxy. That is a complete name of silodosin. How it is given? Silodosin is given as capsule at different strengths like 4 mg and 8 mg. The usual dose of silodosin is at 8 mg taken once daily. But in the people with any renal impairment, the dose of the drug should be reduced. Instead of 8 mg, it can be given as 4 mg given once daily. So that's all about this drug silodosin, which is a selective alpha-1 blocker with high affinity towards alpha-1A subtype, which are mainly located on the smooth muscles of prostate and urethra. So that's all about this drug silodosin. Hope you like this video. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.